Tamara Hunt, PhD, ATC, FACSM, Associate Professor, Georgia Southern University, Department of Health Sciences and Kinesiology. A logo for the CDC appears, featuring an abstract bird made of human faces in profile.
If you are having difficulties with baseline testing, first, identify what that difficulty is. Like there can be a myriad. Is it a timing issue? Is it a lack of Wi-Fi, or is the computer lab not open or available? And so you're just gonna have to troubleshoot within each one of those. You're gonna have to troubleshoot with understanding what your options and opportunities are available to you.
Natalie Schumann, LAT, ATC, Certified Athletic Trainer, employed by a private practice and contracted by a school and elite soccer club.
As athletic trainers, I know we are always having schedules change on the fly, but if you can work within their preseason parameters to schedule baseline, coaches would be more receptive when they see that you're willing to work with them. Be like, I don't want to take a full practice day, but can we take an hour here, or bring your athletes in early? It's important. I feel like coaches, all the coaches I work with now are like, okay, when is concussion time? Which is also a great time to introduce yourself to new athletes and introduce yourself to coaches and parents that you haven't worked with before.
Jana Register Mihalik, PhD, LAT, ATC, FACSM, Associate Professor, University of North Carolina, Chapel Hill. Matthew Gefeller Center, Department of Exercise and Sports Science, Injury Prevention Research Center.
And of course, our planning, there's always going to be hiccups and computers don't work, or, the athletes might not be able to show up, or practice runs long, or, there's all these things these variables that we as athletic trainers are so good at managing. But I think if we can plan around that and again, engage our stakeholders to work with it, that can help set us up for a better baseline testing structure. And the last thing I'll say about baseline testing is that, it is important that when possible, we get this normal measurement. But one of the things about that time of baseline testing is that it really can illustrate the organization and the team's commitment to a concussion safety culture, that, hey, this is something that we care about and we want to make sure that we're taking care of you in the right way. So even if you do a shortened baseline, that might be an opportunity to engage stakeholders in education or a different way. We can use that time effectively and well to really create and start a season or a year off with that positive concussion safety culture.
Click the Next button to proceed. An orange arrow points to the lower right corner of the screen.